Dr. Kobby Appiah-Sakyi is a prominent healthcare leader in Ghana, serving as the CEO of Britannia Medical Center and the president of the African Medical Tourism Council, AMTC. He is dedicated to promoting Ghana as the prime destination for medical tourism, advocating for sustainable practices that enhance healthcare infrastructure while providing high-quality, affordable care to international patients. Under his leadership, Britannia Medical Center has become a key player in West Africa's healthcare system, offering advanced medical services and attracting medical tourists. Dr. Appiah-Sakyi has also championed collaborations with international medical institutions, ensuring that Ghana's healthcare meets global standards. A strong advocate for healthcare reform, he regularly speaks at forums such as the Koby African Travel Market, emphasizing the benefits of medical tourism for local investment and reducing dependence on foreign medical services. Through AMTC, he ensures ethical practices and patients' rights within the industry, while promoting foreign investment to strengthen Ghana's healthcare system. Dr. Appiah-Sakyi's efforts continue to position Ghana as a leading player in the global medical tourism landscape.
Dr. Appiah-Sakyi, thank you so much for coming to Inspire. So please, I'd like to get straight into the interview. Please, could you tell me about your earlier life and what made you pursue a career path in medicine?
Right. So I'm a gynecologist, trained in the UK, and now the CEO of Britannia Medical Center in Community 22 in Tema. How did I become a doctor? That's always an interesting question I get. Basically, when I was in school, my dad wanted me to be an architect. So I went to art school to learn how to draw human beings and trees and all of that. And I wasn't very good at it at all. But I happened to be good in science. So I pursued my science career till I got into sixth form. And then I did maths. I was quite good in maths, so I did maths. And my plan then was to do either of three things, either become a civil engineer or a land economist or a quantity surveyor. These are the three areas where you use your maths. But at the time, I was a Christian, and most of the things I will do, I'll pray about it. So my results for the A-levels came back, and it was extremely good. So I could literally do anything. And I wasn't quite sure which of the three that I wanted to choose. So I lived in Kumasi at the time, so I went to the botanical garden of the university, the Kwame Nkrumah University of Science and Technology, and I went to the botanical gardens to pray.
Wow.
And I prayed the whole day, actually, just trying to get God's mind on what I should be doing with my life. At the end of the day, I couldn't still make up my mind what I wanted to do. So anyway, I put a fleece before the Lord. Lord, I really don't know what I'm doing here, or what to choose as my profession going forward. I'm going back home. Let what you want me to do be the first thing somebody who meets me talks to me about.
Oh, wow.
And that's a bit of a wild one, so I'm not sure if I think in the end I regretted it somewhat. But anyway, so I was going home, and then as I got to my house was on an elevation, so you have to sort of climb up a little hill to go into my house. And then my sister, who was a nurse, came screaming, "Oh, come now. You know, I understand that you can do medicine." I don't like biology at all, and medicine was not in my purview at all.
Oh, wow.
So, oh my God. Anyway, I'd prayed, and I'd asked God that whatever he tells me to do, the first thing that I hear somebody talk to me to do, I will do it.
Oh, wow.
So I said, look, I really don't like this choice because it isn't even part of one of the three that I want to choose.
Wow.
But I said, okay, I prayed, and God has given me an answer. I can decide not to take it, but I can't do that. I'll be disobeying him. So what I'm going to do is I'm going to fill the form and then choose medicine first, civil engineering second. And I'm sure medical school, they'll reject me. So I go and do my civil engineering. So anyway, I filled the form for tech. I didn't even fill my form for Accra, for Korle Bu. I just filled that form in Kumasi. I really was not happy with this whole arrangement. So, Anyway, I filled the form, and then everybody was supposed to be interviewed. I got a letter inviting me to come, and that I'm admitted I don't need an interview. So everybody else behind me was interviewed. I was the only person who was not interviewed. I was at top of the list as well. So I ended up in medical school.
So what made you decide to be an advocate for medical tourism in Ghana?
Right. So obviously I finished my training and then left for the United Kingdom to do my gynecology training. I worked there for 18 years and then I became a consultant there, and from there I left for the Middle East and worked as a consultant in the Middle East for a while. Now while I was in the Middle East, my hospital, which was a big hospital and a very nice hospital, was doing medical tourism for the state of Qatar. This was in Doha in Qatar. So I was part of the group that was thinking and planning and doing the thing that we needed to do to be able to put Qatar on the map as a medical tourism destination for the Middle East. So I kind of understood how medical tourism is organized on a country level. Medical tourism is normally not done as with individual hospitals. It's the country that promotes its hospitals as a medical tourism destination. So having had that experience in Doha, when I now came to Ghana, I realized there was a lot of discussions going on about how we can make medical tourism something that Ghana could benefit from. Medical tourism makes $60 billion around the world, and 6 million Africans travel for medical tourism outside of Africa.
Wow.
So these are huge numbers and huge resources. And as I always say, if you take your dollars and go to invest in somebody else's medical services in their country, you enrich theirs and impoverishes yours. So as many Ghanaians as travel out of Ghana to go and get healthcare, they make other medical services elsewhere better than ours, and they impoverish ours. So a lot of people come to Ghana for medical tourism, as you know. Ghana, across the sub-region, is in terms of medical services, is the best. There's no question about it. And it has been like this since independence. And all across the western part of Africa, from Mali to Nigeria to Mauritania, people come to Ghana for healthcare. And that has been, as I said, from very long ago. Ghana is the first country to have a cardiothoracic unit in this part of the world. And Ghana also has more specialists than you have in most parts of West Africa. So it was very, very necessary. In fact, it was almost ripe that we set ourselves up as a medical tourism destination. Hitherto, people come to Ghana for healthcare, but they don't pay. They look like Ghanaians. They are foreigners and they don't pay. They just pay what all Ghanaians pay. Now, medical tourism, when it's set up right, attracts a lot of money, because when you come in as a foreigner for medical services, you pay more than the indigent, than the person that comes from Ghana. So we're always losing money, not setting up ourselves as a medical tourism destination. So there was a lot of talk about we trying to do that for Ghana. But if you look at our healthcare services, they're not quite where they should be. But over the past 10 years or so, there have been very good modern hospitals that have been built in the country. And 10 of the top hospitals, very modern looking and providing quite excellent international standard of care, decided to come together to form the group that I'm a president of, the African Medical Tourism Council.
Amazing.
And the African Medical Tourism Council is made up of some really prominent hospitals, the University of Ghana Medical Center, the Bank Hospital, the IMA, Focus. So really important private hospitals in the country. And our objective is to try and project Ghana as a place to come and get medical services, which is of international standard. So my job really was to get all these groups together and try and market Ghana as a medical tourism destination in the same way that we've done general tourism. You know about the year of return and how we've marketed the tourism in Ghana, so a lot of people come here in December. It's exactly the same concept that we are trying to do, but now in medicine or in medical care.
Right. So would you say at the core of it, your love for country is what made you pursue
precisely
medical tourism?
Honestly, precisely. It's not, none of what we do is profitable. It's basically patriotism or doing something for the country because it does bring a lot of resources into the country.
Thank you. So with such a field, there must be some challenges and obstacles that you've had to overcome. What are some of the more greater challenges and obstacles that you faced, and how have you overcome them?
So as I've said, medical tourism is normally promoted by countries and by governments. Here we're trying to promote medical tourism not by government, but by individual private practitioners.
Right.
So I think the first thing is the absence of infrastructure. So you have to have the infrastructure. You know, when somebody comes into Ghana for healthcare, it's as if a normal tourist come. These are medical tourists, so they are still tourists. They just have medical needs that needs to be satisfied.
Right.
A tourist coming into the country will need a hotel, a car rental place, a restaurant to go and eat, and so on and so forth. The same thing with the medical tourists.
Right.
They need extremely good hospitals that provide the care they are looking for. They again need hotels, they need the car rentals, they need health practitioners that will tell them where to go and things like this. So that whole infrastructure was not there. And currently what we're doing is putting that infrastructure together. So that's the first thing that has been a challenge, and we're still working on it. We've come quite some ways in getting the hospitals ready and providing all the express passages that allow people to get care quickly. Ambulance services and all of those kinds of things are part of the infrastructure you build. So the first thing that we've had to deal with is infrastructural development. The second is to try and get the hospitals to work together, because if you look at it, these are all private entities that are working by themselves. And now we say, oh, we're all collaborating to be able to attract foreign patients. So getting them to work together as a collaboration has also been a bit of a challenge. But we've made them understand that, look, it is for country. It's really not for, but we're doing it for country. Of course, you're going to get your profit, because when patients do come, you can service them and then make money that way. But let's look at it as a for country project. And I think most people are coming around to that idea. And I think the last one is funding, because hitherto, in other places, government funds these programs. I don't know if you've ever watched CNN, you've seen the Amazing Thailand adverts. So the Amazing Thailand advert, and Thailand is, if you like, one of the top medical tourism destinations in the world. But the government took up all the marketing for the hospitals. The hospitals are private entities, but the government took the marketing.
Right.
In our case, we are having to fund both the marketing and the building of the infrastructure and everything else.
I hear you.
But we're getting there.
I hear you. I hear you. It's interesting that people actually go for lifestyle over health.
Right.
When health is wealth.
Exactly exactly right. Exactly right.
So I want to know, with such a demanding position that you're in, what are some of your mantras? Like, for example, how would you start your day? How do you keep yourself inspired and motivated to keep going? I don't need a lot of motivation. I have a lot of work to do once I get out of bed. And I'm principally driven by impact. Every time, every day, everywhere I go, even as I entered through your corridors here, I had a little prayer in my head that I make some impact here. Nice.
So I'm driven by that all the time. And in fact, I've been privileged also to be impactful in every place that I go. My focus really is service. I'm a reader, and I'll talk about that a little later, but in reading, I've come to understand that you enrich yourself by serving. All right. The story of J.W. Marriott, who built the Marriott hotels, basically all he was doing was serving people. He didn't even own hotels, but he was just serving people. He was serving loaves of bread for people going to pick the plane. And it got so big, now they asked him to set up service on the planes, and then out of that he now built the hotels, and the rest is history. So service is always a very, very good thing to embark on. So I'm driven really more by service to humanity, and most of the things I've done is really, really underpinned by my desire to serve. You see that in the hospital and the way we run it. You see that in literally everything that I do.
Wow.
So that's what inspires me every day. Yeah.
That's so profound.
Right.
What do you feel is your biggest achievement to date?
Oh, that's that's an interesting question. I would say that my biggest achievement is to build the first not-for-profit private university, private medical university in this country. The first not-for-profit one. Most of the hospitals you see that are private are either built by government or built by people who want to make profit. But my hospital is not for profit and is aimed at just serving the community.
Wow, that sounds amazing. How did you start?
So I worked in the Middle East, and I was thinking about what to do after I come out of the Middle East. My time was coming to an end, and I knew that I was going to have to come back home. I'd worked for 25 years out of the country as a doctor, and I felt really impassioned to do something before I retire. I was lying on bed thinking about how my life has been, and things have been generally very good till that point. And I was thinking about what I do. This is 2015 to 2016. So I was thinking about what I'll do in 2016. And then I got a call that, oh, doctor, we have a very big piece of land in Tema that's supposed to be used for a hospital. Do you want it? Now, that was the question.
Wow.
Now, at the time, I had no idea I wanted to build a hospital. So, and I said, without thinking, yes. So I accepted the piece of land, and here I had a piece of land that was supposed to be used for a hospital. So anyway, long story short, we decided to start the hospital. And as I built the hospital, this desire kept nudging me that I should make it a not-for-profit. I should make it a not-for-profit. And
wow,
since my medical school days, I've always been inspired by Mayo Clinic. And I read a lot of books about Mayo Clinic. I mean, Mayo Clinic is some of the best hospitals in the world, and also not-for-profit. So I kept getting this sort of nudge that, look, make it a not-for-profit. So in the end, I said, yeah, that's fine. We're gonna do it like that. But we're gonna do it as I said, as a university hospital, not just as a normal hospital, which is what we have done. And the hospital is 4 years old, but already it's quite a popular and a very, very well-respected hospital in our neighborhood. So a lot of our middle-class community use our service, and we're grateful to God for that. Yeah.
Amen. Wow, what an accomplishment.
Right.
I was going to ask, actually, what do you consider as an accomplishment, and what was a pivotal turning point in your journey?
To building the hospital. Right, so I'm not sure what others do, but when we built the hospital, this was 2020. And if you do remember, 2020 was the peak of the
Very tough.
COVID. Yeah. I came to Ghana in January, 31st of December, 2019. So 26th of January, we opened our doors. We opened our doors to get our workers to come in. And I announced to them that, okay, the hospital is open, but for 1 month, no patients. All the time is yours. We're going to orient you on how this hospital will run. Now, orientation is done like 2 hours when you get any employment. So none of them had had an orientation that goes on for one month or for 3 weeks. I said, no, that's what exactly we're going to do. We're going to do orientation, because none of you have worked in Britain. This hospital is called Britannia Medical Center. So I'm going to explain to you how British people look after their patients.
Right.
So for 3 weeks, I took them through the different things, the different scenarios, and the different policies that we have and how we're going to run the hospital. I have several other companies, but my principle in building companies is always focus on culture. If you get the culture right, the rest is easy to do. So a lot of the training I gave them was about culture, how we talk to patients, how we speak over the phone, how we deal with one another, how we, the how-tos was really what I focused on. And a lot of what I said was about the culture, the environment, how we keep the place clean, things like this. And I just did it for 3 weeks, and then I flew out. I flew out of the country because I was still in my paid job elsewhere. And then I handed over the leadership to a group of people that I have employed, that I have asked to play leadership roles in various things. I came back towards the end of the year. And when I came back, they had employed other people, and now they were doing orientation for them. And I sat at the back of the meeting, and when I heard the people I had trained now training others, I knew I was on the winner. In fact, you could close your eyes and think I'm the one speaking. The culture had become so embedded, now they understand it to teach others.
Wow.
And since then, I've not done any orientation. They do all the orientation by themselves.
Wow.
And the culture has still persisted to today.
That's amazing.
So that's, if you say what memorable thing I've done, that's something that I've done that I'm really proud of.
Sure, and a very, very big accomplishment.
Yeah. Yeah.
Okay, so we're just going to go for a short break.
Okay.
You've been watching Inspire with me, Monique Laws, and Dr. Kobby Appiah-Sakyi. Stay tuned for more. Welcome back from the break. You're watching Inspire with me, Monique Laws, and today's guest we have Dr. Kobby Appiah-Sakyi. Thank you for coming back to us. It's been a pleasure talking to you. For professionals aspiring to get into healthcare and medical tourism, what advice do you have for them?
Right. So obviously it's medical tourism. So you have to be either a medic or somebody who is a tourist professional to get into it. I think there are people who, support medical tourism in other countries. So even here in Ghana, there are people who help Ghanaians to go to India for healthcare, they get paid for assisting in that process. I think if anybody wants to kind of work with us, then it will be good to just make an approach, and then we will have a chat. We certainly are looking for Ghanaians that would help us advertise in countries like Senegal, Liberia, especially even French-speaking countries. 8 of our neighbors are French-speaking out of the 17 in West Africa. So those who can speak French and then sort of go talk to people in some of these French-speaking countries about coming to Ghana and getting healthcare are definitely people that we want to talk to. But I think at the bottom of it all, whatever you do as far as medical tourism is concerned, you really must be passionate about healthcare and assisting people who are sick. Medical tourists are sick people needing healthcare. So you definitely must care about the sick and be willing to support. It does create a lot of job opportunities, medical tourism, when it comes into any country. And there'll be a lot of opportunities for people to do different things for these medical tourists that come in. It increases the number of use of hotel rooms. It increases the number of use of restaurants. There are a lot of things that it does bring. And as I said, you combine it with also different types of general tourism, and it does bring a lot of business into countries. So it depends on which part. If you want to play the medical part, then yes, there's a lot of medical work that goes there. And if you want to play the sort of the tourist or take advantage of the tourist opportunities, again, there's a lot to do. You just need to ask, really, and there should be opportunities for people that want to come into it, yeah.
Amazing, amazing. So for my next question, I feel you touched on it briefly by telling us how great your leadership skills are. But how do you find the balance between being the CEO of Britannia Medical Center and being the president of African Medical Tourism?
So I do several other things apart from these two. So I'm also as a director of a big school. I own a software company. And then I also, as you said already, I'm the CEO of Britannia Medical Center and the president of African Medical Tourism. So I do quite a lot of things. But the way I go about what I do is by goal setting. I set goals. And I'm very particular about goal setting. I set goals at the beginning of the year. I set goals every month. And normally I'll set goals or look at my goals every week. And then every day I'll sort of write a few things that I need to do out of the goals that I've set for the month. So goal setting is a really important skill that I've developed over the years. I developed goal setting, well, in the way I do it now after I read a book. And that book was also written by a Christian, Stephen Covey's book, The 7 Habits of Highly Effective People.
He's a Christian?
He's a Christian.
Wow.
Stephen Covey is a Christian. Yes,
I've started reading that book.
All right, okay. So,
That's
well,
amazing.
you need to give me all that you're doing here. So Stephen Covey's book talks about, I think it's 8 chapters or so, I can't remember, but, it talks about the importance of seeing what you want to do and then working your way back from the beginning to the end of it.
Sure.
And that really changed the way I think about goal setting. I used to set goals, but after reading that book, my idea of how you set goals completely changed. And in fact, the way I do it from that time to now is basically the way he taught to do it. And it's been extremely effective for me. So for effective leaders, goal setting is the thing. And as I said, that book was really helpful to me. Yeah. So that's how I plan my day. I said
that sounds amazing. Yeah. So how do you feel your work in healthcare and medical tourism has pushed you as a leader?
Right. So the way I lead, all the companies that I lead are pretty similar. My concept of leadership is servant leadership. So I came here and your CEO was telling me that I'm the servant here, and that's exactly the way I look at leadership.
I love that.
And you see, the Bible says, Jesus said that the one that will be head among you must be the servant of all. That's really how to lead. If you want to lead people and you sort of boss over them and talk to them anyhow, you can't lead people like that. You must be the servant, the listener, the one that everybody comes to, the approachable one. And that's basically the way I live. So I'm willing to carry the boxes. I'm willing to serve water. I'm willing to clean the shoes. I'm willing to do anything. Literally, I'm not joking. I'm willing to do everything. In my workplace, if you're late, you pay 3 Ghana cedis. I pay 3 Ghana cedis when I'm late too.
Right.
All right. So I'm willing to be down there with everybody else. So my leadership style is basically servant leadership, which basically means that I go there to serve first and foremost. My work as a doctor is service. I'll wake up at 2:30 and go and deliver a woman who needs my attention, and no questions asked. And all my team knows that Dr. Appiah will be here at 3 a.m. It doesn't matter, okay? But they know I'm there to serve. So all what I do in AMTC, African Medical Tourism Council, in the hospital, in the school. On Saturday, I was in the school because they had a Saturday class. I would go sharing chocolates to the children. Everything I do is serving. So my leadership style is basically servant leadership. Yeah.
Wow, amazing. Thank you so much for your time and your effort today. And finally, do you have any words of advice for our viewers at home?
Well, so inspire, which is basically the title of our conversation, is important. We need to inspire people. If you ask me what I will say to inspire somebody, there are only a couple of things I will say. One, a lot of what I do comes from my reading. I read a lot. Over the weekend, myself and my son were reading a book together. So we finished the whole book in a weekend. But a lot of what I do, a lot of what I say, a lot of what I teach comes from my reading. So it's really important that people have a lifestyle of reading. When I sit in the airport or I sit in a plane, I realize that a lot of people are saying that nobody's reading. And sometimes that hurts me, because if you go back to England and you're sitting in a train, you realize everybody's reading in the train. In Ghana, I see it very, very differently. And I think that we need to encourage people to read. That's really important. And secondly, I have an attitude to learn. I have an attitude to learn new things all the time. This morning, I pick a book, a new book. It's not a reading book, a medical book. I will read it and start from the beginning. I'm reading. So I have an attitude to learn. And if we have an attitude to learn, and we're readers, and we like to serve, if we do these 3 things, we definitely will make an impact. So in terms of sharing something, that's all I want to say.
Wow. So powerful. Thank you so much. It's been an absolute pleasure.
Right.
I hope you've been inspired as much as I have. You've been watching Inspire with me, Monique Laws, and Dr. Kobby Appiah-Sakyi. Bye for now.